Good morning. In today's video, let us study cartilage and how to draw them. Cartilage is mainly classified into three varieties: hyaline, elastic, and white fibrocartilage. First, let's learn about hyaline cartilage. This is the most common type of cartilage which is found in our body. Hyaline cartilage has got outer perichondrium, that is what we are drawing now. So it is made up of fibrous tissue, mainly containing type 1 collagen fibers. The perichondrium should be drawn with wavy, small fibrous structures, like how we are drawing now. We have to draw wavy lines without much space in between. So this represents the dense connective tissue, type 1 collagen fibers. So this perichondrium is present in most of the hyaline cartilage except the articular cartilage where the perichondrium will be absent. So through the perichondrium only, the nutrient which is required for the cartilage will be transported. So inside the cartilage there won't be any blood vessels. This fibrous perichondrium is very much essential for the growth and maintenance of the cartilage tissue. Deep to the fibrous perichondrium there will be cellular perichondrium. So this is how the cells of the cellular perichondrium is appearing. These are placed in a horizontal fashion. These perichondrium cells are nothing but the chondroblast cells. These chondroblast cells are the main cells which are responsible for the growth of the cartilage. We can draw one or two layers of these chondroblast cells which are elliptical in shape, and inside we can fill in the cytoplasm, and later on we can place the nucleus in the center. Now inside the substance of the cartilage we can draw some gaps. So these are the gaps which are nothing but the lacunae. The lacunae are the spaces inside which the chondrocytes will be arranged. So we can draw multiple lacunae like this, so that when you fill in the matrix we will not shade the lacunar part. So we have to draw as many lacunae as possible. So multiple lacunar spaces will be seen, and these spaces will have the chondrocytes inside it, and together there can be up to 8 chondrocytes which can be there inside a single lacunar space. So this group of chondrocytes will be called as cell nest. Next we have to shade the gaps. This shading represents the matrix. Matrix mainly consists of type 2 collagen fibers and chondroitin sulfate. The matrix will be glass-like, homogeneous in appearance. Since it is glass-like, it is called as hyalose. Hyalose means glass-like. That's why the term hyaline cartilage is coined. The matrix is slightly basophilic. So after shading with eosin, we have to use hematoxylin so that the matrix looks slightly basophilic. Around each lacunar spaces, that is around each cell nest, there will be fine collagen fibers which will form a basket-like appearance around each lacunar spaces. So these fine collagen fibers which form basket-like appearance is called as the territorial matrix. So this territorial matrix can be drawn by using fine shading around each lacunar spaces. So this represents the territorial matrix. The matrix is mainly secreted by the cells which are present inside these lacunae, the chondrocyte cells. So the chondrocyte cells are the one which maintain this matrix also. The rest of the matrix which is present around this territorial matrix is called interterritorial matrix. That's what we have drawn as glassy appearance with slight basophilic staining. Next we have to draw the chondrocytes inside these lacunar spaces. The chondrocytes can be drawn either 2 or 3 or 4 or up to 8 chondrocytes can be drawn inside each cell nest. So one aggregation of this lacunar space with multiple chondrocytes is called as cell nest. So we can draw the cells and fill in the cells in each lacunar spaces. After completing all the lacunar space with chondrocytes, we can draw the cytoplasm for these cells. So we have to shade the cytoplasm inside the cells, and after completing the shading of cytoplasm for all the chondrocytes, we can place the centrally placed rounded nucleus for these cells. So the nucleus are centrally placed and rounded for these chondrocytes. These chondrocytes which are present inside these lacunae are produced by the chondroblast cells, mainly which is present in the periphery. So the flat cells what we have drawn in the periphery in the perichondrium, the chondroblast cells are the one which is mainly responsible for the production of these chondrocytes. Finally, we can place some fibroblast nucleus along the fibrous perichondrium. So these dots represent the fibroblast nucleus which is present in the fibrous perichondrium. This marks the end of hyaline cartilage. The next type of cartilage what we are going to study is the elastic cartilage. So here also the perichondrium is same like that of the hyaline cartilage. We have a fibrous perichondrium which is made up of collagen fibers. So the intermittent wavy fibers what we are drawing right now represents the fibrous perichondrium. Immediately deep to the fibrous perichondrium will be the cellular perichondrium, where the chondrocytes are placed in a horizontal fashion. So oval cells with centrally placed nucleus. Inside the matrix we can draw the gaps which represents the lacunae. Then coming to the matrix, it is similar to that of the hyaline cartilage, and the cell nest, the number of chondrocytes in each cell nest will be lesser when compared to that of hyaline cartilage. And the salient feature of this elastic cartilage will be the elastic fibers. The matrix is mainly made up of elastin, fibrillin, glycoprotein and type 2 collagen fibers. Numerous elastic fibers will be seen in the matrix of this elastic cartilage. The elastic fibers in the elastic cartilage gives great flexibility. So repeated bending will not cause much damage to the cartilage. Elastic cartilage is seen in external ear, laryngeal cartilage, etc. Now what we are drawing is the elastic fibers. You can see the arrangement of elastic fibers. So this should be present all over the elastic cartilage inside the matrix, and only the cell nest has to be spared. So now what we are drawing is the territorial matrix in each cell nest. So after completing the territorial matrix, we can place the chondrocytes inside the lacunae, just like how we have done for hyaline cartilage. Now what we are drawing are the chondrocytes inside the cell nest. So this is how we have to draw the chondrocytes. After completing the chondrocytes, we can shade the cytoplasm. So each chondrocyte cytoplasm has to be shaded. Now we can place the nucleus using hematoxylin. So for all the cells which are drawn already, the chondrocytes inside the lacunae, and also some of the nucleus has to be kept on the fibrous perichondrium, which represents the nucleus of the fibroblast. This marks the end of elastic cartilage. Next slide what we are going to draw is the fibrocartilage, the white fibrocartilage. White fibrocartilage is seen as a transition between fibrous tissue and the cartilaginous tissue. So here the matrix is mainly composed of the fibrous tissue, that is collagen fiber. Here the matrix contains both type 1 and type 2 collagen fibers. So this is one among the place where type 1 collagen fiber is seen. First let's draw the matrix which contain the collagen fibers. So already we know the features of collagen fibers. The collagen fibers run in bundles. Only the whole bundle branches. Here we can see the branches from the bundles, and in between the bundles there are some gaps. These gaps will have oval cells which are seen in a row. So these rows of oval cells are the chondrocytes. White fibrocartilage is mainly seen in intervertebral disc. After completing the fibers and the cells in between the fibers, the chondrocytes cytoplasm can be shaded this way, and finally we can place the nucleus after shading the cytoplasm. So nucleus is centrally placed we can use the hematoxylin to place the nucleus. So these are the features of white fibrocartilage. This marks the end of cartilage series. Thank you.